Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging.
So, how was your week?
It was good, thanks. I had a patient who reminded me of something that we've been needing to talk about, and that is somebody with a significant dementia who might live in an assisted living facility or nursing home and has to go to the hospital, taken into the emergency room. And all too often, family members are notified that an event has happened and this person is going into the emergency room. And they assume that the facility will send a nurse with them and all of the records, and that then the emergency room staff will know what to do. And that's not the case. Sometimes the chart goes with the person, but not all the time, and you can't count on it. Lots of times the emergency room staff will only have a list of medications, and the transportation person that is with the patient doesn't know the history, doesn't know the medical conditions, and of course the patient has dementia and can't share that.
That's right. And staff in emergency rooms really don't know the difference between assisted living versus nursing home versus a retirement center. And so they'll start asking the person questions and thinking that they'll probably get discharged back to the nursing home when actually they're going back to their apartment in the retirement facility. So
yeah, and it goes something like this. Where do you live?
Over there, down the street, down there.
You live by yourself?
Yes.
Yes. You're independent?
Sure.
Mm-hmm.
And it's not true.
It's not true. So that can be a real problem. You need to make sure that the emergency room has appropriate information.
That's right. And these days, nurses in emergency rooms come to us and say, we really need more training in how to manage people with dementia. And there's even a movement on now to have emergency room specialty areas for people with dementia, but that is very rare these days.
It's way in the future to see it in any
kind of experimental, actually.
And it needs to happen, but until it does, once again, you got to fill in the gaps. Because unless somebody looks grossly confused, it's rare that emergency room staff will pick up on dementia. And they're frustrated too. They've got a lot going on, and they really don't have the time to meticulously pick through a history and figure out what's right and what's wrong. They depend on the information you hand them. So the care will be better if you can get good information to the emergency room staff.
Either that means that you have to be there or someone that you've designated to be there with your loved one. The worst cases, I think, are when someone is pleasantly demented and is very cooperative and may be there, they may have a very serious illness, but when the nurse says, are you in any pain, they'll say, oh no honey, I'm fine. And then the emergency room personnel are wondering, well, why is this person here? And they may send them back without any treatment. But then what happens if the person is admitted to the hospital then? That they figure out, oh, this is what's going on, and they're admitted to the hospital. We think that hospitals have highly trained staff that are able to deal with any situation, with any patient, and most times that's true, but again, nurses tell us in the hospital, we're not trained to deal with dementia. We're trained to deal with medical problems, physical problems.
If the hospital has a psychiatric unit in the hospital, they may know more about dementia and behavioral kinds of problems. But hospitals are really trained to deal with any kind of physical problem. And dementia becomes a behavioral problem, especially when somebody is admitted, for a number of reasons. First of all, if you're physically ill and you have a fragile brain that has dementia, the physical illness itself makes the cognition worse and the behavior worse. Being in a different environment makes the behavior worse. As you pointed out, medications, pain medications, all make people more confused. So sometimes it actually looks like a person's dementia abruptly worsens because of a hospitalization, when in fact it may be a delirium plus the dementia, which is something we can talk about another time. But it takes some real care to manage people like that.
So if your loved one with dementia is likely to have some medical problems that may lead to an emergency room admission or even just going to the hospital for other reasons, you need to have in place as much information as possible ready to give to the people at the hospital in the emergency room. You need to be able to get there to help them. Somebody in the family needs to be there with them, or someone that you've designated to go with them, like a care manager or a private caregiver, someone who can talk to the staff and help them understand better about your loved one.
In the hospital, you may need to look at even having 24-hour sitters in the room. Again, hospitals are not set up for 24-hour sitters. And the pleasantly demented person who is very, very sweet and not causing any problem, the nurse may leave the room and say, now, Mrs. Jones, call for help before you go to the bathroom. Remember, you've got a hip fracture. You can't get up. Mrs. Jones says, okay, fine, thank you, and promptly gets up because that information didn't register because there's dementia there. So you need to have these things in place, because if there is a hospitalization, you want it to flow smoothly, and the advanced planning is the only way to make that happen. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.